and each person that goes in, there is a point where maybe you correct the problem, and in a sense, you say we've basically done all you could for them, right?
Correct. And one of the things that we feel as physical therapists is we actually don't want patients to come back in the clinic. We want to make them better.
Yeah.
If they come back for a different diagnosis or a different problem, that's great. But we don't want them to return with the same problem. And how we do this is we develop a really good home exercise program.
Yes.
And we want to give them the knowledge base of what's going on and why their problem, why they're having their issue, so they can correct it. Right. So self-correction, following up with a home exercise program, and then eventually a discharge. And kind of the criteria for discharge would be the patient has met all their goals. On the initial evaluation, we ask them, what do you expect out of physical therapy? So we may have that we want them to put their arm above their head. In your case, when you had your shoulder, I need to be able to put back dishes up in the cupboard.
Right.
I need to be able to get on my hands and knees and wash the floor.
Yes.
I need to be able to drive. Those are all goals that we may set for you.
Yeah.
Once you've met your goals, at that point, you're independent with your home exercise program. That would be an appropriate time for discharge.
Right. Now, what about, isn't there a lot of forms to be filled with Medicare patients?
Unfortunately, there is a lot of paperwork to be filled out, and one of the reasons why we fill that out, there's a big turn towards medical necessity. And again, we talked about that before, but we need to prove as physical therapists that what we're doing is justified and what we're doing is a skilled service for the patient.
Right.
So with that, we want to ask as many questions as we possibly can, because sometimes when people come in, for example, I'll say they're coming in for a shoulder bursitis like yourself, and say they're right-handed. And we might ask a question, do you have problems driving? No, I don't have any problems driving. You don't? Well, I use my left hand. Well, that might be acceptable for them, but if they're a right shoulder, if they're a right hand dominant and it's a right shoulder issue, we need to be able to make sure that they can drive with their right shoulder.
Yes.
If it's something that they've always done.
Right.
So that would be a case of when the physical therapist has to maybe draw a little bit more information from the patient as to what's going wrong with them.
Right. Yeah.